I am going to talk a little bit about OGB, the problems that we find ourselves with right at the moment with OGB, and some potential solutions. I'm going to start with a little history. In 1950, the legislature gave our various state agencies the authority to go out and contract with health insurers to provide insurance for their employees. And I guess it was predictable, but what happened? Every agency was on its own, and it went out in a lot of different directions, like a bunch of, free-range chickens. And one agency had great health insurance, another agency had not so great health insurance. So in 1969, Governor McKithen said, look, there's got to be a better way. He directed his Commissioner of Administration to consolidate all those plans into one. And that's when OGB was born. VJ probably remembers that. He might have been there. OGB stands for the Office of Group Benefits. It's located in the Division of Administration. It's an office within the Division of Administration. If you read the statutes, though, and a number of folks for the first time have read the statutes creating OGB recently, OGB is supervised by the commissioner, and under the law, the Commissioner of Administration has unfettered discretion to decide what premiums are charged for health insurance and to decide what health insurance is actually going to be offered. There are 230,000 members of OGB. These are active state employees. These are teachers. These are retirees, these are their spouses, and their dependents. If you break down the numbers and you look at these 230,000 fellow citizens, they're not a particularly wealthy group. I know we read a lot in the paper about the people with the flags in their offices making big retirement bucks, but for the average retiree and the average active employee in Louisiana, that's not the case. In fact, if you look at the numbers, we have 49,000 retired teachers in Louisiana, most of whom are getting we actually have more, but we have 49,000 of the total retired teachers, most of whom get their insurance from OGB, who make a pension of $30,000 or less. We have 15,000 teachers who have a pension, retired teachers who have a pension of $10,000 or less. OGB has a board, as we've learned about recently, but frankly that board has no power. The commissioner can overrule the board. It's advisory only. It meets infrequently. When it does meet, it often doesn't have a quorum, and for a couple of years the governor didn't make all the appointments to the board, so it really hasn't been a part of this debate. Currently, OGB offers 3 plans, really 2. It has what they call a consumer-driven plan, but less than 1% of our folks are a member of that plan. We basically have an HMO and we have a PPO, 2 plans. The state contributes, if you're an active employee, the state contributes 75% of the money, whether you're in an HMO or a PPO. The employee has to contribute 25%. That's taken out of his check. The state contributes 50% of the money if you decide to add your spouse or your children. And the employee has to contribute 50%. It's a blended rate of about 67% contributed by the state, 33% by the participant. The commissioner has described the current plans as being very rich. And that supposedly is one of the reasons that we have to make the changes proposed by OGB. But I will tell you that the facts don't, and the evidence does not bear that out. There has been a report, some of you have probably seen it, done in August by the Pew Charitable Trust and MacArthur Foundation. Very instructive. If you haven't had a chance to read it, you should. Basically, this report says that of the 15 southern states, this was a comparison of employer-provided health plans by states by every state in the United States. If you look at the 15 southern states, Louisiana's plan in terms of richness is in the bottom third. And on the richness gauge, we are well below the national average, the current HMO and the current PPO plan that we have. The OGB plan is in trouble. I think we all know that. It's a mess financially. If you look at its finances, it's kind of like Thelma and Louise in that car headed toward the cliff, okay? OGB is spending $16 million a month more than it's taking in. On an annual basis, that's $192 million. Our fund balance, according to the Legislative Fiscal Office, the fund balance in OGB, if we continue to operate at this level, by June of next year, will be at least a negative $50 million. Now, the Commissioner implemented a premium increase effective July 1 of this year. That's going to help. It's going to generate about $60 million a year, but it's not going to fix the problem. How did we get here? You can't know where you ought to be going unless you know how you got to where you are. In April of 2011, the fund balance in OGB was $525 million, according to the Legislative Fiscal Office. In June of 2014, the end of our fiscal year, just a few months ago, the fund balance was $207 million and dropping by $16 million a month. $318 million was gone. Why? That is an issue that's going to be discussed, I hope, a lot over the next couple of months. I will give you my perspective. It's pretty simple. The state took the money. In 2013 and 2014, out of the blue, the Commissioner reduced the premiums for the Office of Group Benefits by 9%, 7.11% in 2013 and 1.77% in 2014. Now, why would you do that? Well, I'll tell you why I think it was done. Because the state has to put up 75% of the money. By reducing the premiums, the state had to put up less money, which means that that money that didn't have to be spent on OGB could be spent on balancing the budget. And if you go look, if you go look, we all know that the cost of health care has been gradually rising in America over the last 10 years. Some years it increases faster than others. Actually, last couple of years it's been fairly muted. We'll talk about that in a second. But if you look at the premiums at OGB, this comes from the Legislative Fiscal Office, in 2008, premiums went up 6%. In 2009, 3.7%. In 2010, they were flat. In 11, 5.6%. In 12, 8.1%. And then all of a sudden, out of the blue, like a thunderbolt, in 13 they go down 7%, and in 14 they go down 1.8%. And that is when the financial problems at OGB stopped. Now, don't just take my word for it. This is my opinion, but if you go look at the Legislative Fiscal Office reports, one of the reports says, and you're familiar with the LFO. They're very talented people. I don't know anything about their politics. I don't know what party they're in, but they do know numbers. According to one of the report, this is a direct quote, the state has, quote, indirectly utilized OGB's fund balance to support the fiscal year 13 and fiscal year 14 operating budgets, end quote. If you look at the most recent OGB report, or rather LFO report about OGB, bear with me, but I want you to understand this is just not my opinion. This is what the LFO says. And this is after some legislators fussed at them for putting out the first report that told the truth. So they had to put out a second report. This is what the LFO said in the second report. By not funding OGB's anticipated growth in expenditures within a 2-year time frame, And by reducing premiums an aggregate of 8.88% within a 2-year time frame, OGB was required to expend its reserve to pay for its expenditures. This method reduced overall state expenditures within the budget, which resulted in funding becoming available for other purposes. Now that's what happened. And it's happened in other areas as well. In 2000, we created the Medicaid Trust Fund for the Elderly in Louisiana. The idea was that we were going to not touch the principal. Treasurer's office was going to invest that principal, generate interest, and the legislature could spend the interest on health care for the elderly, but that principal would be there for our children and our grandchildren. In 2008, it had $830 million cash in it. At the end of this year, it will have zero. That savings account has been rated as well. The Tobacco Settlement Trust Fund has been rated. A couple of years ago, the state, through a constitutional amendment, capped the amount of money that can go into the Tobacco Settlement Trust Fund and diverted the revenues going into the trust fund to pay for TOPS, which frees up money in the general fund to balance the budget. So this has been you can see the systemic approach here. There's a pattern to this. Let me talk a little bit about the response of the Division of Administration, because I understand, and you do too, on complex issues, there are always two sides to every story, and I do try to look at both points of view. The position of the division has evolved. Let me put it that way. I think that's the most charitable way to put it. The first position was that, well, let me go back to 2011, when the issue of OGB came up in terms of privatization. Then Commissioner Paul Rainwater was quoted in one of the papers as saying, quote, "The OGB surplus," that's what he called it, "will never be, quote, stolen or, quote, diverted to balance the budget." And I believe Paul meant that at the time. Paul left, and that's exactly what they did, was divert the money. The most recent position of the division, the commissioner wrote an op-ed piece about 2 months ago that was published, and she said the proper way to look at this issue is one of opportunity, that basically all is well, all is well. Whenever I hear all is well, I think of Kevin Bacon at the end of Animal House. Remember that? Where they're about to stampede him? All is well. This is what the commissioner said. The changes to the 2015 plans will make OGB's plans look more like the dynamic quality plans that are typical in the private sector. Now, in the division and OGB's testimony before the Joint Legislative Budget Committee, a week before last, we've now moved from all is well to we have a crisis and we have to adopt these plans or the plans will go broke. There are two reasons given by the division, specifically when they're pressed about the cause of our financial problems. One, they say that health care costs have been increasing for some time at the rate of 6% a year. That rate's assumed. If you look at the LFO reports, the ones done by the Legislative Fiscal Office, they're very careful to say the numbers we're using, the 6% increase in health care costs, were given to us by OGB. I don't know that those have been challenged. I'm not saying they're wrong, but I would like a second set of eyes to look at them. Our experience has been different. The Kaiser, you might have seen the article in the Wall Street Journal about a month ago, but the Kaiser Family Foundation and a group affiliated with the American Hospital Association did a big study on employer-sponsored health plans in America. And what it concluded was, quote, cost of employer health coverage continues its muted growth this year with a 3% increase. And it noted that the increase in employer-sponsored plans last year was only 4%. And we've seen that in our Medicaid program. Why? The aftermath of the recession. So that 6% increase, I'm not saying it's not accurate, but I'm saying it's worth double checking. The other argument made by the division is basically our consultant actuary made us do it. Well, first of all, if you look at the statutes, these decisions are made by one person and one person only, whoever the Commissioner of Administration might be. An actuary hired outside the department or inside the department cannot overrule a decision by the Commissioner. Number two, I assume that she is talking about Buck Consultants. Buck Consultants is an actuarial firm. They're founded in New York. They've worked for the division since 2009. We have a consulting contract with them. We spent about $2.7 million on their contract. Buck Consultants is part of Affiliated Computer Services, which is now part of Xerox. I've checked. We've got about 4 contracts with them, consulting contracts with them, worth about $45 million. But I digress. Buck Consultants has a problematic past. If you want to learn about the background of Buck Consultants, you need to go read the transcript of the cross-examination of Buck Consultants at the lawsuit involving the changes to the state's retirement system. Bob Klausner, if you're ever bored, Randy knows Bob, did the cross-examination. And if you read that cross-examination, you'll find that Buck Consultants has a problematic past. They had to pay $600,000 to a county, Mendocino County in California, for alleged errors in their actuary work. They're currently in litigation with Providence, Rhode Island, over their actuarial work there, an alleged $10.8 million mathematical mistake. I'm not saying Buck's numbers are wrong. I'm saying I believe in trusting and then verifying. I will say this: why would any actuary who knows anything about health insurance in America, if you're looking at 6% annual increases in the cost of delivering the health care through the health care delivery system, recommend that premiums be cut? Why would an actuary do that? I think it would be instructive. I would like to see the actual actuary report recommending that. How am I doing on time? I'm okay. Let's talk quickly about the proposed solution. The division has implemented a 5% increase, as we know, effective July 1. That's in effect. In addition to that, that's not going to stop the bleeding. The OGB has proposed 6 new plans. You know, they got some cutesy names with a lot of dreamy talk about them. There's not much meat on the bone. Basically, here's a copy of the book that I got at home. You probably ought to go read it. It's basically a PowerPoint presentation. But this is the bottom line. Through these 6 plans, by raising copays, raising deductibles, raising coinsurance, restricting care through prior authorization, changing the drug formulary, OGB is proposing to shift $192 million worth of spending to the employees and the retirees and the teachers. That's kind of the bottom line. The LFO has done a report. The average out-of-pocket expense by the average participant in OGB, if these plans become effective, is about 47%. And that's not going to do the trick. If you read one of the footnotes in the Legislative Fiscal Office report, you'll find that they suggest that on top of this, after a 5% premium increase, shifting $192 million worth of costs to the retirees and the teachers and the employees, after doing all of that, the next fiscal year, 2016, we're going to have to raise premiums again by 7.2%. So these are some pretty dramatic changes. If you look at the plans, the first problem I have with the plans is there's very limited information. Very, very limited information. They're basically PowerPoints. I'll give you an example. I'll give you 2. The Magnolia Local Plan. It's one of the 6 plans. It's a plan only for Baton Rouge, Shreveport, and New Orleans. Its premiums are lower than some of the other plans, so I suspect a lot of employees are going to be tempted to go to the Magnolia Local Plan. Well, if you look at the Magnolia Local Plan, if you get sick and you're in Baton Rouge You can't go to the Lady of the Lake Teaching Hospital, into which Louisiana taxpayers are pouring millions of dollars. You can't go to Oxnard. You can't go to Women's Hospital. You can't go to the Lane Memorial Hospital. You can only go to the Baton Rouge General. If you're in New Orleans and you join the plan down there and you get sick, you can't go to East Jefferson Hospital. You can't go to West Jefferson Hospital. You can't go to Touro. You can't go to Children's. You can't go to the hospital in New Orleans East. You can't even go to the brand new $1.2 billion teaching hospital we're building. You can only go to Oxnard. Now, my point is this. Oxnard and the Baton Rouge General are excellent hospitals. Excellent. That's not the point. The point is that employees and retirees and their dependents and teachers need to have this information before they make a decision. I'll give you another example. The Magnolia Open Access Plan. Okay? There's only one plan other than the consumer-driven plans that gives you access to providers outside the network. Let's suppose that you need a heart transplant, and you say, well, you know, I can't afford to fool around with this one. I think I'm going to go to the Cleveland Clinic. And you can do that under the open access plan. You go to the Cleveland Clinic. The bill's $100,000. If you look at the PowerPoint, it says, well, the state will pay 70% and you pay 30%. You say, well, that's a lot of money, but it is a heart, and I kind of need it, so that's not a bad deal. But then you read the fine print. That's just 70% the state will pay of the allowable charges. So as best I can tell from reading the PowerPoint, you get a $100,000 bill. OGB says our allowable charges are $30,000. We'll pay 70% of the $30,000. We'll pay 70% of the $30,000. You pay 30% of the $30,000. That's $9,000, except you're going to get a bill from the Cleveland Clinic for the difference between $100,000 and $30,000. It's called balance billing. So you just paid $79,000 out of $100,000 of the bill. That's not health insurance, folks. That's just not health insurance. And if I'm accurate, I'll admit to you it's hard from the PowerPoints to figure this out. But if I'm wrong, I'll admit it later. But I challenge you to try to get better information because it's just not there. That's not health insurance. I'll mention one other thing. Under emergencies, they're careful to point out in the PowerPoint that if you have an emergency, you can go to a hospital outside of your network, and that's the appropriate approach. There's just one problem with that. If the bureaucracy decides later that it wasn't an emergency, you got to pay the tab. So if you go to an emergency room with a really bad headache, you think you're about to have a stroke, you go and it turns out you're not about to have a stroke, you just have a really bad headache, you've got to convince a bureaucrat that you don't have to pay 100% of the bill, that it really was an emergency. The final point I'll make about the plans is we've hired a company called Ansophone out of California and Florida to field employees' questions. And I know they're trying. I really mean that. But it's clear to me they need more help. We're paying them about $1.3 million to do that. That's one of the reasons the administrative costs under the new plans are going to be about $56 million a year. But I asked one of my colleagues at Treasury to make a call and saying, look, I'm going to call you. I asked her, I said, look, call them and tell them you're from Baton Rouge and you're thinking about joining the local plan. If you get really sick and you have to go to a hospital, where do you go? So she did. She called them up and said, I'm from Baton Rouge. I'm thinking about joining the Magnolia local plan. If I get sick, what hospitals can I go to? The folks in California didn't know. They tried to look it up. They couldn't figure it out. So they referred her to the third-party administrator. The third-party administrator got on the phone, looked at it, said, Schumpert. Well, Schumpert's in Shreveport, okay? Now, eventually they got it right. But my point is, and this wasn't an isolated instance, I asked a number of my colleagues to make these calls. We've got to do better there. All right, in my last 5 minutes, I'm going to leave at least 10 minutes for questions. What do we do about this? We've got several options. First option is put the money back. That would be the right thing to do. That's not likely to happen. The state doesn't have the money, and I don't see the current administration making the changes we've got to make in Louisiana state government to generate the money. So while that might be the right thing to do, put the money back that the state took, I don't see that happening. The second option to me is more realistic and better in some respects. Start over. Let's just start over. And the legislature can lead the charge. And we need to proceed under the Administrative Procedure Act. You and I both know that the average person interacts more with a government agency than with a treasurer or a governor or the legislature. Most of people's interaction is with agencies. Agencies get their power from the legislature. The legislature delegates that power to them. But the legislature doesn't just say to agencies, go do whatever the hell you want to do. You have to follow the Administrative Procedure Act, which means if when an agency wants to do something dramatic that would impact a person, they've got to publish a rule. They've got to give notice of the rule. They've got to hold a hearing where people can come and disagree with their rule and make suggestions. They can't just put the rule out there. They've got to have evidence. They've got to have data. After they're finished, the agency promulgates the rule. Then the legislature gets to review the rule. Our legislature needs to review these plans. Now, it doesn't have to. If you look carefully at the statute under 49:968D1A, I don't want to bore you with a lot of citations, it says the legislature may exercise its jurisdiction. I'm asking the legislature, please, as respectfully as I can, exercise your jurisdiction. The jurisdiction will be under the Joint Legislative Committee on the Budget. Critique these plans. And as you do so, I would respectfully suggest you ask for the opinions of two other folks. Number one, the legislative auditor. And more to the point, the actuary for the legislative auditor. At a minimum, some actuary needs to verify Buck Consultants' numbers. We've got an actuary on staff in Darrell's office. I would like to see Darrell advising the committee, helping our Joint Legislative Committee on the budget work this out. Secondly, I would, and this is not my idea, this comes from my friends at PAR, Robert Travis Scott, and I had a long conversation day before yesterday, Dr. Steve Procopio. The second thing I think the legislature ought to do is ask PERSAC to weigh in. I know some of you are sort of wondering what PERSAC is. PERSAC is a little-known board. It stands for Public Retirement Systems Actuarial Committee. Its membership is comprised of the Commissioner of Administration, the President of the Senate, the Speaker of the House. Usually they send designees. The Treasurer, the Legislative Auditor, an actuary from the statewide retirement systems, and an actuary from the state retirement systems. They set the rates for the retirement systems. They set the employer contribution and the employee contribution. They're in charge of giving advice on the UAL amortization schedule. That's what they do for a living, and they're really, really good at it. The legislature needs to ask PERSAC to take a look at this. They're actuarial experts. The final thing that I would suggest that the legislature ought to consider doing, one of the complaints I've heard from many state employees is, look, we know we got to take a hit here. We know we've got to sacrifice like everybody else. We'd like to pay part of the increase through a premium and part of the increase through curtailed benefits. They don't have that option. Under the plans proposed by the commissioner, under the 6 plans, the employees and the retirees and the teachers have got to take the whole hit by basically rationing care through lower benefits. If you look at the numbers, the Legislative Fiscal Office did a report. In order, if we didn't change any of the benefits, we just did it through a premium increase, it would take an 18% premium increase. That's how bad a shape this fund has gotten itself into, 18%. That breaks down to a $96 million contribution by the state, $90 million by school boards, $37 million by the state employees. That would be an average increase of $13 a month. If you made the state employees take the entire hit, so through the premium increase, I'm not recommending it, but if you did, I will tell you some state employees I think would opt to do it. They'd keep their current level of benefits. It would cost them about $80 a month more, or about $963 a year, but that's a whole lot better than some of the co-pays and deductibles and out-of-pocket maximums I see on these dreamy new plans. Long term, It's clear to me that it is unhealthy to have one single individual under the law have unfettered discretion in a political environment to set premiums and decide who gets health care and who doesn't under the Office of Group Benefits. There's got to be a better way. I'm hoping the legislature will look at moving the Office of Group Benefits under the jurisdiction of PERSAC. That's not my idea. That's Robert Travis Scott and Dr. Steve Procopio at PAR are shortly going to be coming out with a report that I think is going to make a similar recommendation. I'm not saying PERSAC is perfect, but it's got a cross-section of people on it, from the commissioner to the president of the Senate to the treasurer to the legislative auditor. They do it for a living. They've done a good job with the retirement systems. They can do an equally good job for OGB. We have got to get this agency out from the smoke-filled room where these decisions are being made into the limelight, into the sunlight, where these decisions, which impact the lives of so many people, are transparent and they're made in a public hearing where people can challenge them or at least understand them better. Second thing we probably ought to do, and then I'm going to hush, it's clear that if we do that, I don't even know if we'll need an oversight board at group benefits, but I would rather have a belt and suspenders. I'm hoping the legislature will give the oversight board at group benefits some actual power, because they don't have any right now. None, zero. I would like to give them some authority and make them do these things in public meetings. That's all I have. I want to emphasize this final point. Look, I'll put my small government credentials up against anybody's. This is not about smaller government. The employees and the teachers and the retirees understand they're going to have to sacrifice here, and they are, like everybody else. But they've got a legitimate point of view here. Their attitude is, look, we did sacrifice. We gave it the office. We'd built up $525 million, and these chuckleheads took it. How do we know they're not going to take it if we put it back in? And when they ask for answers, all they get is bromides. And that's not right. This is not about smaller government. This is about treating people with fairness and with respect. I'll be glad to answer questions. The state has a health insurance plan, like most large employers, for its employees, teachers, and retirees. We call ours the OGB plan. The OGB plan is right now financially kind of like Thelma and Louise in that car headed toward the cliff. It's about to go broke. The reason is that the state went in and took the money. In 2011, we had a savings account of $525 million set aside at OGB to pay claims. The state went in and took the money to balance the budget, and now the fund's in trouble. The state is proposing to right the ship by increasing the amount of money that state employees and retirees and school teachers have to pay by $192 million a year. My suggestion is there's got to be a better way. And I'm encouraging the legislature to do its job. Under the Administrative Procedure Act, it has the right to exercise its jurisdiction, to hold hearings, to get the help of the legislative auditor and his actuary, get the help of our PERSAC committee, which sets the rates for our retirement systems, and let's see if we can't figure out a better, fairer way. The employees and the teachers and the retirees that I've talked to understand they're going to have to sacrifice like everybody else. They understand that. They're not trying not to do their part. But their attitude is, we gave it the office. We had $525 million built up. The state took the money, and now they want us to pay $192 million more to fill it up again. Are they going to take it a second time? And that's a very fair question. To me, this is not about the size of government. This is about treating people fairly and treating taxpayer and employee money with some kind of transparency. They have hired a group called Ansophone out of California and Florida. They're paying them $1.3 million in terms of a contract. I don't know why Louisianians couldn't do it, but be that as it may. But if you call those toll-free numbers, they don't, and ask them about the 6 plans, they don't know anything. Okay, they just don't know anything. One of my colleagues at Treasury called them and asked them about which hospital to go to in Baton Rouge, and they said, go to Shumpert. Well, that's in Shreveport. Now, they may not know the difference between Baton Rouge and Shreveport in California, but we certainly know here. I mean, that's a 4.5-hour drive, for God's sakes. We need to do a better job of designing these plans. We need to do a better job of communicating these plans. And finally, after we get this problem fixed, and it can be fixed if the legislature will wade into it, we need to take this Office of Group Benefits out from under the jurisdiction of one person. One appointed bureaucrat, the Commissioner of Administration, can make all of these decisions. How much you pay, what doctor you can go to, what doctor you can't go to. That's not a good way to run things. We need to take that authority and put it under the PERSAC committee, comprised of the governor and the treasurer and the lieutenant and the legislative auditor and the president of the Senate and actuaries to make these kind of decisions in a public meeting. That's my point of view. The rollout of this plan reminds me of Animal House, okay? I keep waiting for somebody to start talking about the Germans bombing Pearl Harbor. I mean, if you've seen Animal House, you know this thing is a mess. You know, it's making the rollout of Obamacare look like a model program. We can do better, but to do better, the legislature's going to have to get involved, get the legislative auditor involved, get his actuary involved, get the PERSAC committee involved, get the actuaries at the retirement systems involved, and let's slow this train down. You're dealing with the lives of 230,000 teachers, employees, retirees, their families, their children, their spouses. This is not some political game. This is serious business. Now, we've got a lot of problems that I confess to you I don't know how to fix, but this is one problem that can be fixed. But we're not going to fix it by continuing to do what we've been doing.
What kind of an impact is this having on all these state employees, and how many employees statewide are affected by this?
Well, this impacts 230,000 people, not just state employees, but teachers. It impacts retirees. It impacts husbands. It impacts their wives. It impacts their children. I mean, that's a lot of folks. And all of a sudden, this program is over 45 years old. The Office of Group Benefits has had a pretty solid history. It's always been there. The premiums have had to go up on occasion because the cost of health care goes up. And all of a sudden, the bottom is falling out. And they're having these 6 new plans with the cutesy names thrust upon them. You can't get any information. If you want to learn about the plan, all they give you is a PowerPoint. If you call on the phone and ask questions, you get somebody in California who doesn't know the difference between Shreveport and Baton Rouge. There's got to be a better way here, and I think there is a better way. We need to slow it down, and the legislature needs to get involved.